Ovarian cancer is not just one disease. 95% of it is a specific type called epithelial ovarian cancer. That's a disease of postmenopausal women, largely. That's the one where people are the most afraid of. But we've learned over the years that even that's not a monolith. There's different types of epithelial ovarian cancer. There's some that present mainly as a pelvic mass. And women will know they have pain in their pelvis and pressure symptoms, and they're caught very often early stage. And then you have the one that really scares people, where the symptoms tend not to have to do with the primary tumor. The symptoms are more gastrointestinal symptoms. Very often we find out it's from the metastatic sites. It's from the disease that has already spread. But studies have shown even with early stage disease, some women present with these very non-specific and vague symptoms. My experience is that they don't always tell the same doctor all these symptoms. The constellation of presenting symptoms from ovarian cancer may seem unrelated to you. So the more knowledge that we get out there to say that it may have this constellation of symptoms, hopefully more patients will present quicker. Right now, there is no good screen for epithelial ovarian cancer. While we search for that holy grail, that screening test that's effective, there are things you can do to protect yourself. One of the most important things is to recognize that ovarian cancer has a very strong familial component. If you have a first-degree family member who developed ovarian cancer, particularly at a young age, there's a chance that you have a mutation in your family that you were born with an increased risk of this disease. And the oral contraceptive has been shown to be a very effective chemoprevention. That pill leads to about a 50% reduction in the risk of ovarian cancer. Studies have shown for years that the outcome of ovarian cancer is heavily dependent on who you go to and who takes care of you. GYN oncologists, like myself, doctors who are specially trained in the treatment of GYN cancers, get by far the best outcomes. Better than general OBGYNs and better than even general surgeons, because it's a very different disease, and I think people who understand the natural history of the disease and how to treat it obviously get better outcomes.